control challenges that can often come with Parkinson's. And she'll be sharing valuable insights to help manage those issues. On a personal note, I've had the privilege of knowing Dr. Fletcher in multiple ways. She was my wife's neurologist, and we navigated some of these very issues. And she also owns a care home where my wife spent the last year of her life. And through these experiences, I've come to know her as both an outstanding physician and a deeply compassionate caregiver. She's currently co-director of the Sutter Pelvic Health and Continence Center in Santa Rosa. She's originally from Napa, so she's been here a long time, although she got trained at Columbia in New York and the University of Pittsburgh. And she specializes in surgical and non-surgical treatments for urologic and pelvic floor disorders. We're truly fortunate to have her today, and please join me in giving her a warm welcome.
Hi guys, I'm so excited to be here because I have a few messages that I really want to get across to people, all people really, but especially my patients with neurologic illness. And I'm going to emphasize them as we go through, especially with neurologic illness such as Parkinson's disease, multiple sclerosis, and stroke. Urinary control and bowel control issues can be extremely challenging, and many primary care physicians and general neurologists do not really have the breadth of knowledge and expertise to manage them. So they often get swept under the rug as, oh, this is just part of your disease. And what I want you to know, this is the first issue to really drive home, is that if you are having problems with urinary or bowel control, yes, that is part of your problem because you have a neurologic illness, but there is always something we can do for it. There is always something we can do to help manage this and make it easier on you. So if you feel like your primary care physician or your neurologist is not addressing that issue with you entirely, please ask for a referral. And I'm not saying that to drum up my own business. I'm just saying that we can really, really help. So let's start with urinary incontinence. I think there probably are some statistics slides here, but what I want to tell you is that in my 20 years of practice so far, about 95% of my multiple sclerosis patients and my Parkinson's patients are going to have a serious problem with urinary control. And this is why. In order to have normal urinary control, your bladder and the muscles that surround your bladder have to be on very sensitive neurologic switches. Those switches are finely tuned with the brain and the spinal cord, and they rely on normal conduction of those nerves up and down the spinal cord and in the brain. So when illnesses occur like multiple sclerosis, Parkinson's, stroke, spinal cord injury, the very first thing that will happen after what we call musculoskeletal disorder, which is where you use your arms and legs, cognitive, you want to use your arms and legs, are things like bladder and bowel control. Okay, so incontinence is when either the muscle around the bladder or, I'm gonna come over here, so either this muscle here around the bladder doesn't hold properly, so it has abnormal spasms which push out the urine, or this muscle here, which is the sphincter of the bladder, doesn't open and close properly, okay? So normally, I see in my practice every day people who are aging, who have a problem with one or the other, okay? But unfortunately, if there's a problem with the nerves, such as a neurologic illness, there are problems with both. And that's what makes treating bladder control in someone with a neurologic illness an actual specialty, because it does take a specific person who knows how to deal with both of those problems at once. Let's see. Here we go. So, types of incontinence. We have stress incontinence, which I mentioned that's the sphincter muscle that opens and closes the bladder. We have urge incontinence, which is the muscle around the bladder that's doing abnormal spasms. And then we have mixed, okay? So with a neurologic illness, you're going to have mixed. And then with Parkinson's, unfortunately, you may also have urinary retention, where the valve doesn't want to open and allow you to release urine. So I'm gonna get into that in just a second. So here's stress incontinence. Stress incontinence is the sudden involuntary loss of urine with cough, sneeze, laugh, or lifting, okay? Occurs very commonly in women of older ages. Our sphincter weakens and can't hold enough when we're doing these straining activities. And then urge incontinence. Urge incontinence is where you feel the urge to go to the bathroom and you can't make it in time, or you almost can't make it in time. A very common example would be as you're driving up to your house and you're walking to your front door. All of a sudden you see your front door and you have to go to the bathroom so bad. That's urge incontinence, and that spasm is triggered by just the thought of getting home. But it shouldn't trigger like that. That's abnormal, and that can be fixed. So urinary incontinence affects 25 to 45%. That's a large range, but I would say 45% to all women as we age. And as I said, if you have a neurologic illness, that's going to increase up to 95%. And then the effects. So these are some things that people come to me and they're already experiencing. They're wearing pads, and the pads are wet and irritating their skin. They're waking up frequently from sleep, because as they sleep, the bladder is doing those abnormal spasms and waking them up. So waking up more than 2 times a night, is not desired, and it can be fixed. Avoiding physical activity, because you don't want to go out and play cards with your friends, because you'll be looking for the bathroom. When you do, you're not sure if there will be a bathroom nearby, or maybe not going to the library to check out books, because the library bathroom is always busy when you're there. So we don't want people to have to avoid social and physical activities because they're worried about their bladder control. So that the embarrassment and the social withdrawal. Also, people don't want to be a burden on their families, and many nursing home admissions for older people are due to urinary incontinence. We can really help older people as well. Once again, that's something I hear a lot from patients who come to me, and they say, well, my primary care doctor told me it was just part of aging. Well, yes, it is part of aging, but we can still help you with it. There's a lot of things that urologists can do to help with the bladder control of aging. And then the most important one here is the middle bullet. We do know from continuing statistics that not many people seek help. So just want to remind you all that there are people out there that can help with this problem. Okay, I'm gonna skip over that because we're mainly gonna talk about the risk factors of neurologic disease, okay? So risk factors for urinary incontinence, neurologic disease. So once again, it goes through that without getting too scientific, because I have some very fancy scientific slides of the spinal cord and the nerves that go up and down. But basically, there are nerves that go up and down from the spine, from the brain to the bladder, and they have to go, those nerves have to go through very, very finely tuned switches between holding your urine and urinating. It's also different when you're sleeping, right? And we take those for granted until they start to act up on us. And knowing how each one of these neurologic conditions damage those switches and make bladder control difficult is really important. But all of these particular disease categories, the patients in those categories are also experiencing the same kind of problems. Now, there are also things, everyday things, that can make bladder control even worse, right? So diuretic medications, that's your water pill that you might be taking, hydrochlorothiazide, medications that reduce your high blood pressure but cause you to pee more. Once again, we can work around that. Diabetes, obesity, constipation is a big one that can make urinary control worse and more difficult to work with. And aging, which is where the skin around the vaginal opening is thinning and aging, can make make the bladder more irritated. There's other things that make urinary incontinence worse that are just part of every day. These are little things you can tweak that might help. Bladder irritants like coffee and tea, artificial sweeteners, wine, acidic foods, chocolate, and something that we don't see as much here is smoking. I wrote this when I was in Texas, so there were a lot more smokers there. So in terms of treatment, and then this is the other thing that I want to really drill down on, is that there are many different treatments, and don't let the vast list of all the treatments available also be intimidating, because it would be specifically tailored to the patient. The key is just to keep in mind that there are many treatments available, many more than people realize, and we can help for all the different types of incontinence, like stress incontinence. You can even just go to physical therapy for this. We have a specialized physical therapist at Sutter Hospital, and then there's another woman who has a practice in Rohnert Park. They are specific physical therapists who have trained just to help people with bladder control. But then you can go all the way up to getting a big surgery if it's indicated. And those are a number of the surgeries. And then the same for urge incontinence. You can try pelvic floor physical therapy, biofeedback, avoiding certain foods in your diet, or you can go all the way up to some very fancy surgeries. We have Botox injections into the bladder, and a pacemaker that we can install in your body to help work your bladder better. These should not be intimidating. They're things that I do every day for people who have problems holding their bladder. I do want to make one point though. These medications, I don't think you're going to memorize any of this, but these medications have to be taken very, very lightly in patients specifically with Parkinson's disease. Those four right there should not be given to patients with Parkinson's disease. Those who are taking a carbidopa, levodopa medication, which is probably just about everybody, right? So very important if you are taking a medication for bladder control, make sure you speak with your physician about it, because that class of medication should not be mixed with what we call the uptake, with the carbidopa-levodopa medications, okay? I really don't like it when I see patients who come in and they've been on those medications at the same time. So the goal also of stepping in as a urologist, in addition to helping patients make sure they're not on the wrong medications and make sure they know all their options, is to make sure that they're emptying their bladder. So we go back to those special switches in the spinal cord. You need to be able to empty your bladder completely, something that for years we all take for granted. But with neurologic illness, the muscle that controls the sphincter that opens and closes your bladder may be disrupted neurologically and may not open properly. In that case, you're retaining extra urine, and that urine can back up into your kidneys at times and slowly over time cause some kidney dysfunction. And we would call it renal impairment. And also that extra urine building up in the bladder can cause urinary tract infections, and it can cause worsening incontinence. So this is where we have that dreaded talk with patients about using a catheter to empty their bladder. Sometimes that's needed, and it happens as urinary dysfunction progresses with neurologic illness of all kinds. It's not a bad thing. It actually saves lives. And we have wonderful, tiny little disposable catheters that you can use and throw away. So I know it's probably the first time many of you are hearing discussion of using a little catheter, but if anyone brings that up again in the future, just remember that it's very doable. Many of my patients have to use these little catheters and they do just fine, okay? And a good prevention program with these catheters will help prevent urinary tract infections. Using a catheter like this is not going to cause infections forever, like some people think. That's a very common misconception. And then I just want to touch on urinary tract infections, because that's definitely going to come up in the Q&A. It's very, very common. If you use a catheter to empty your bladder and you're worried about infections, or you don't and you're just worried about infections in general, they are very preventable, and we teach prevention. And part of it is knowing the true symptoms of a urinary tract infection, not just running to the doctor when you have incontinence. You need to have burning with urination and acute onset of urinary frequency, bladder spasms, and fever. Dark urine, cloudy urine, and foul-smelling urine are not signs of a urinary tract infection. They're actually signs that you might be retaining old urine in your bladder, and you might need help with emptying. Okay. So I just want to make sure I'm not going over maybe 10 more minutes, or 55 and...
Keep going.
Okay,
Fine.
okay, good. So these are ways to prevent urinary tract infection. Make sure you do urine cultures with your doctor. Don't just treat yourself and then ask for antibiotics. Have good habits in the toilet, wiping in the correct direction, voiding regularly, make sure you're emptying completely, avoiding moist environments. Like, for example, if you like to use the pool for pool therapy, don't sit around in your wet bathing suit afterwards. Make sure you get out and dry off, and drink a lot of water. But the other place where this fits in with the water is, you might be thinking, well, if I have trouble holding my bladder when I go through Costco, why would I want to drink more water? It's just gonna make me have to go to the bathroom more frequently. So that's where I can help you with both. Okay, we'll combat the urinary incontinence, help you hold your bladder better, and then you can drink more water and prevent your urinary tract infections. All right, and then also treat constipation and consider a cranberry supplement, but only a good one. And then a closing thought. There are so many things you can do to improve incontinence and bladder health. Don't let that get swept under the rug, okay? And the urologist is really the one who's gonna sort out all these little particular things for you and get everything just kind of dialed in so that they're working together. And that's it. Okay. Yeah.
Thank you. Questions?
Yeah, that's a lot of information, so
Yeah.
please ask questions.
Are you familiar with the TENS treatment, the electronic?
The one with the needle or
No, you put the little thing, electrode stimulation.
on your back or your ankle?
Ankle.
Ankle?
And how do you know?
Okay. Yeah. So those have been studied. The needle in the ankle has been studied. The TENS unit doesn't really have a lot of data. We're hoping that it will help. You need to use those for a very long time until you're sure they're working, okay? So it's gotta be used for at least 12 weeks straight. And then you can make your determination whether it's working or not. To be honest, I wouldn't invest in one if someone's trying to sell you one. I wouldn't invest in that. There's way better treatments. We have one we do in the office where we use an actual acupuncture needle. And that's been very well studied and has about a 75 to 80% success rate. But also takes about 12 weeks to get started. In general, I will address that. This is a very good question. There's a lot of products on the internet and in magazines that just really don't work very well. So you want to be wary of spending a lot of money on something like that. I wouldn't invest in that if it's expensive. I would get the one in the doctor's office. It works much better. Yeah.
I actually know a Parkinson's patient that had the 12-week treatment, but then it didn't last as long as they hoped, and he was going to get a TENS unit to see if he could use it daily to keep the treatment going. So
Yeah, you could
don't know.
always try it. It's just that if it's a big financial investment, we can't say from data or anything how well they work.
my question was about Botox and how effective that's been with patients with neurologic problems.
Yeah, so Botox is phenomenal. Botox in urology was developed for people with multiple sclerosis, okay? So it was developed in a lab which was within the larger multiple sclerosis center at the University of Pittsburgh in Pennsylvania. It works phenomenally well because with the neurologic illnesses, stroke, multiple sclerosis, Parkinson's, and spinal cord injury, it's those horrible overactive bladder contractions that occur day and night and cause the urine to start coming out before you can make it to the bathroom. And by paralyzing just a few little segments of muscle around the bladder, you can get the bladder to relax normally so that those abnormal spasms don't occur, but you can still urinate. It's important to remember though that if you're already having trouble emptying, the Botox would make that worse. But that might be going down one step too far because you wouldn't even have the Botox conversation with your doctor until they really knew all those things about the specific person. But Botox is life-changing. It really is.
How do you determine whether prostate issues are causing the problem or whether it's Parkinson's?
Yeah, very good question, thank you. So it's not difficult for a urologist to figure that out. And it would mean coming into the office and getting some testing. But that is what we do every single day. Your primary, I mean, I'm not trying to speak badly about primary doctors, but a primary care physician cannot figure that out. And they usually just assume that if you're a man, it's your prostate. But many times it's not. Or it could be a little bit of both. So you need to see a urologist and you need to get tested by these tests that we do. And we can tease apart bladder dysfunction from prostate problems and figure out which is which. Yeah, it's actually, for me, it's easy. I do it every single day, but it does have to be done in my office. I can't do it over the phone or, for example, just by talking to you. I have to do some testing. Mm-hmm.
Could you tell me what is least invasive, Botox injection or the sling?
Oh, well, they're actually done for two separate things, okay? So the Botox injections are given for the abnormal spasms of the bladder. That like, gotta go, like I can't make it through Costco without looking for the bathroom, or waking up frequently at night. The sling is for leakage with cough or sneeze or laugh or like bending over and picking something up. And that's when that leakage comes out, the sling would help that. So it's important to know the difference and know which one we're treating. So someone might come in and only have one problem, the bladder spasms, then they get the Botox. Or they only have the stress incontinence, which with cough and sneeze and laugh, and they get the sling. And then some people have both, and they would get both. So two very great treatments for two very separate problems, specifically having to do with bladder control. Mm-hmm. Questions over here?
Come get you next.
And the Kegel exercise, is that at all helpful when you have Parkinson's?
Yeah, absolutely. Kegel exercises are great, and we recommend those, and we also recommend maybe seeing one of our special physical therapists to make sure you're doing them correctly, and then they can give you a few other exercises that you don't even know about that you can try. And then on top of it, they have biofeedback, which tells you, how to do it and how hard to hold it and that kind of thing. They give you a little program, and then you come back and they're like your private trainer of your bladder, okay? So yeah, I'm a big proponent for those kind of exercises, absolutely. Mm-hmm.
Yeah, a couple of questions there. First of all, what are the exercises that are possible that can be done? You mentioned Kegels. What is that for? Like, is there anything else for exercises to help any therapy?
Yeah, absolutely. So your physical therapist is going to evaluate you, right? So and see where you have weakness or where you're having trouble. The other exercises, it's a combination of stretching and exercises. So it can lower back, glutes, inner thigh, all of those things are in the pelvic region, and it is a comprehensive program. It's much more than just Kegels.
Okay, the other question I have is about, you said increasing intake of liquid water.
Uh-huh.
will help healthier bladder,
Yeah.
things like that, kidneys. My experience is that it does make me urinate more, but it seems like I'll go to the bathroom, and then when like 15, 20 minutes later, I gotta go again and again. Is that normal? Is that healthy? Is that like too much? Is that my drinking too much water?
No, it could be a sign that you're not emptying completely. So, yeah, and that's very good. It's nice to hear it in people's own words, what's happening. So that feeling like you go to the bathroom and then you have to go again and maybe 15 minutes later, but you just went to the bathroom, right? And especially at night. And that is sometimes can mean that when you urinate, you're just urinating a little bit off the top and there's volumes that's left behind. And so then you make more urine, and each time you urinate, you're just urinating a little bit, and the bladder's filling more and more. And so I would definitely say that would be an instance where you should be evaluated to make sure you're emptying your bladder. Yeah.
For a man who's 76 years old, how often is a reasonable number of times to go to the bathroom at night?
Okay, 2. So if you're going to the bathroom more than 2 times, there's help. Yeah, there's help for that. I mean, you shouldn't have to be waking up all night long, right? There could be a very simple, like medication or an exercise or something very minor that we could tweak and help you with that. Yeah, for sure.
Getting my exercise.
I was gonna say,
For those of us who have had our prostates removed, well, in my own case, there was light incontinence for many years, and now there's gotten semi-serious. Is that something that can be treated?
yes, yep. So that's because that's another, even though it doesn't seem like it, that's another nerve problem. So when the oncologist takes out your prostate, almost by definition, they have to cut through the nerves that operate the sphincter that opens and closes your bladder. So it's not working as well. So the way we treat that is the same way we would treat a woman with stress incontinence. Is we have four different treatments, okay? The first one is physical therapy, which they may have initially recommended.
Therapy being Kegels?
More than just Kegels, okay? The second, there's 4. The second would be an injection, not of Botox, but of a bulking agent. It's called Bulkamid. And basically what we do is we inject that right at the opening of the bladder where it gets narrow. And it's a bulking agent. It's not exactly the same thing, but it's similar to the stuff that they put into women's lips to make them puffy, right? And it's gonna puff up that area there and give you more seal. It's kind of like adding brake pads, right? And that works very well. It's not perfect and it doesn't last forever, but it works well. There is also a male sling, okay? I don't do the male sling, but I could refer you to someone who does. And then finally, there's a larger surgery, which is the artificial urinary sphincter. You may have heard of that. That's an amazing, miraculous thing, where they basically take a silicone cuff and put it around the neck of the bladder, and then they give you a little control pump that's buried in your scrotum. And you can push it to open it and close it and urinate when you want to. Yeah, it's pretty amazing. And we would send you, No, you don't want those.
For the last one?
The last one.
Yeah, is there a downside?
It's a surgery. It's a surgery, yeah. And so you would need to go, and the specialist, this might also be a downside, is that the specialist who does those is in San Francisco. But it's great. I used to do those when I was at the university, but I don't have the resources to do those here in Santa Rosa. So, but I can tell you at UCSF or Stanford, that would be excellent. Yeah.
2 more questions.
Yeah, I'm a caregiver, and I Googled on UTIs, urinary tract infections, and Parkinson's, and it was scary.
Yeah.
All the stuff that comes up, because Parkinson's predisposes you to UTIs because of the loss of the muscular control, and UTIs exacerbates Parkinson's because
Yes.
of the neurological effects of a UTI. So really watch those things.
Yes, and prevention is key. There's a lot you can do. So drinking a lot of water, right? And that's been proven to reduce urinary tract infections because it's if anybody here is an engineer, it's a laminar flow. So the flow of urine is rubbing against the sides of the urinary tract and scraping off the bacteria and basically flushing it out, right? So drinking a lot of water is very important. The second one is a high-dose cranberry supplement.
Now we're using a high-dose cranberry supplement and D-mannose.
Yeah, so unfortunately there's some really big data came out recently that D-mannose doesn't help.
Well, that'll save the shoppers buying some things then.
Yeah, don't waste your money on D-mannose. It's also a sugar, so if you happen to have diabetes, D-mannose can raise your sugars. And that's something that people don't understand. So the cranberry supplement, it's a whole lecture in itself, but you see how my eyes light up? I love talking about this. So cranberries, yes, cranberries prevent urinary tract infections, but how, right? There has to be an active ingredient. There's actually a scientist at Rutgers University who found that the active ingredient in the cranberry that repels bacteria from the urinary tract is called the proanthocyanidin, okay? That's really important because knowing how this happens can help you develop the supplement that's really gonna help. So if we took a whole garbage bag full of cranberries and we mashed them up, how much of that proanthocyanidin, how much of that active ingredient are we gonna get? Turns out pretty little. You'd be full of cranberries. Well, most supplements will just mash up the cranberries and give it to you. If you look at it, it'll say there 100 milligrams of cranberry, and you think, wow, that's great, that's a lot of cranberry. But you're getting the skins and the seeds and maybe a few leaves thrown in if they didn't get them all out, and juice. But what you need is the proanthocyanidin. So there are supplement companies that extract the proanthocyanidin from the cranberry, and that's really important. It's one of the little nickname for proanthocyanidin is PAC, P-A-C, and you want to get at least 36 milligrams of PAC. Costco has a supplement which is like 4 milligrams of PAC. So if you want to take, do the math, 5? If you want to take 5 or 6 of those every day, that's fine, you can. But there are a few companies that have them in one pill. And one of those is Allura, and then there's another one called Utiva, and you have to take 2 of those capsules. So just make sure that you're getting the proanthocyanidin extract in your cranberry supplement. Yeah, so that's drink more water, take a proanthocyanidin supplement, and take a probiotic for bladder health, especially for women. We have different bladders than men do, so it's really important. And I just have seen so many great probiotics for women coming out recently. Lots of good products, and those can be anything, any good probiotic for women's health. Oliver's, Whole Foods, yeah.
Bonus points for anybody who can spell proanthocyanidin.
Yeah.
One more question.
I have found unsweetened cranberry juice to be effective. Is that just placebo?
No, it's good. If you can get 100% pure cranberry, so a lot of people get the one at Trader Joe's, but just make sure it's not, you can't be drinking your ocean spray or cran apple.
That tastes terrible.
Yes, it makes your toenails curl off, right? Yeah, okay. That, if you drink 4 ounces of that a day, you're getting 36 milligrams of proanthocyanidin. So you can mix your own fresh water into it, and that's fine to kind of get it down. And you want to try and get it down all in one sitting. But yes, that's another good option.
Sophie, thank you so much.
Sure, of course.
We really appreciate your being here.